Hey guys, how you doing? Mike Galbraith here. I'm a family and sports medicine physician. I have a special guest today. This is Marty from the Lethbridge Hurricanes. Do you want to say hi, Marty?
Hi, everyone.
It was great. I thought it would be great, since we work with the Lethbridge Hurricanes, see lots of athletes. Marty is a really key part of the medical team for the Lethbridge Hurricanes, so we wanted to interview him. We're going to grill him, ask him lots about his job, and he's going to inspire us today. No pressure.
Perfect.
Good. So first of all, we thought, I've got a list of questions, real questions this time. Marty, can you tell us, what is an athletic therapist?
So an athletic therapist, I deal with all the medical issues with the hockey team. We do a lot of the rehab, assessment, the strength conditioning, and the overall safety of the players on the ice. So I'm the first responder on the ice. I coordinate all the doctor's appointments, get them into my favorite doc of all time.
Where? Oh. But I often think of him, and I don't want to put words in your mouth, kind of like the dad of the players, and he takes care of everything, especially like medical, right? So
exactly. It's kind of a man of many hats, but it's a fun job. You're in the trenches, as I call it, every day.
So how long have you been with the Hurricanes then?
This is my 4th season with the Hurricanes, 5th year in the Western Hockey League.
4 years though? Wow.
Yeah.
Time flies.
And 20th season as a trainer.
That's crazy. So where did you do your schooling for athletic therapy?
I did my schooling for athletic therapy at the University of Manitoba, and I did a previous degree at Augustana in Camrose. So
cool.
2 bachelor degrees and then a national certification in athletic therapy.
So maybe outside of, let's say, the Hurricanes, what other types of teams have you worked with, and other types of, let's say, environments and avenues have you worked as an athletic therapist?
Well, hockey's been my passion, so I've been fortunate enough to work with many levels of Hockey Canada. I was a student intern with the Manitoba Moose in the American League. I've worked junior A and university and college, right down to minor hockey, but I've worked track and field, football, a little bit of baseball, and anything that there's a sporting event at. I guess one of the highlights was a cheerleading event that was kind of out of my element, but definitely an eye-opener. That was pretty crazy and a lot of injuries.
Yeah, cheerleading, fun fact, did you know, one of the most dangerous sports, right? A lot of serious injuries in cheerleading.
Yeah, there was some flips that were coming pretty close to the backboards that were pulled up in the basketball court. So yeah, it was high-level athletes.
Yeah.
I didn't realize it, but it was a fun event to work.
So that's one of the cool things I think about the field of athletic therapy, is it's so diverse. You have a great background in medical knowledge, especially dealing with injuries, and then you can work all over the place in university, minor leagues, professionals, etc. And so Marty's with the team. Well, maybe I'll let you explain, but talk a little bit about your role more with the team, what you do on the road here in Lethbridge, etc.
So a game day, we have a morning skate. We bring players in, do pre-game stretching. We have a skate that I'm on the bench for. We're doing, making sure that all the first response stuff is available. If there is an injury, whether it's practice or game, myself and other athletic therapists coordinate an emergency action plan that we have various pieces, but we want to make things run as smoothly as possible. So that's one of the most important parts of the puzzle. But I travel with the team. I'm dealing with giving updates to the coaches, to the general manager, relaying information back to the doctors and my medical team here in Lethbridge, so that we can coordinate stuff on the road to have things run smoothly back here, because we want the players off the ice as little as possible. They're a valuable asset on the ice, so that's important. Aside from that, I book all the appointments. We coordinate the doctor's appointments, massage, chiro.
But other than that, you're really not that busy.
No,
Just kidding.
16 to 20 hours is usually minor on most days, but no, it's
his off season is like 2 months in the summer, like
yeah,
if that.
It's awesome. It's I always say it's the next best thing to playing, being in the trenches and being with the team, and that hockey atmosphere is something that I love and have a passion for.
How about maybe two more questions? So one is, let's say you have a young person, maybe high school, university, they want to be an athletic therapist. What are some things they can do to help them kind of reach that goal?
Well, I always say that, volunteer or reach out to medical personnel in the field. I've had some great students come through here, and I grew up with the learning environment of teams and mentors, and I really feel that that's the way to start. And I'm a big believer in giving back to where you've come from and remembering your roots, and hands-on experience is second to none. So that's the number one thing. The other thing is make sure that you have a good base in the sciences in high school. Strive for high academics, because it is competitive to get into the field of athletic therapy or physiotherapy. And once that competitive stream happens, they have so many candidates. There's only 7 schools in Canada for athletic therapy. So
it's competitive.
and there's only usually about 20 to 25 students per program per year. So
wow.
So it's the people that have the passion are the ones that get far, because early on, you do it for the love and the money comes, but you definitely don't do it for a big paycheck starting out.
Yeah. It made me think, and I apologize, this is kind of going back, thinking about your role with the team and things that you do with your team. You talked about hands-on. You mentioned earlier you were the first responder. So a lot of times, if you're not familiar with athletic therapists, if you're watching, let's say you're watching an NHL team, maybe you're watching an NFL game, and you see an injured athlete down on the ice, down in the field, usually the first go-to person is the athletic therapist. And then maybe more athletic therapists, and then usually the one strolling kind of arrogantly might be the doctor. So kind of like, if you need me, right? All right, let's say last question. That was a little sidebar, sorry.
Yeah.
So last question, let's say you have some up-and-coming hockey player, I don't know, maybe they're 12, 13, 14 years old, and you want to give them 3 tips on how to improve just general performance in hockey. That's a big question, but as an athletic therapist, what do you think are some of 3 key things to help them reach good performance?
I think flexibility and mobility is key. A lot of players, as they grow as an athlete and grow as a person, their body is catching up with them. So body mechanics and that with growth spurts can kind of be awkward. And we run into problems with hip flexor injuries, core injuries, and shoulder injuries for the most part. So we want to make sure that flexibility and mobility goes hand in hand, and a good pre and post stretching program is important. Having a good cardio, because the pace is at this level and pro is fairly high. And the other thing is nutrition and sleep. It's huge. It's a 68 game schedule regular season, and preseason post tack on. So I think they say we travel across Canada 4 times total in the league.
That's crazy.
There and back on the bus. So
that's amazing.
You have to optimize sleep and nutrition.
So it's interesting you say that. So Marty didn't know I was going to ask him some of these questions. So I had an athlete in my office yesterday. I had a 14-year-old, pretty high-level hockey player, big kid, and he spent a lot of time in the gym, really bulking up, but he was easily 3 times my size. And I'm sure he could beat me up in a back alley. But when we were talking about what are 3 key things to improve his performance, guess what 3 things we talked about? I said he was tight as a drum, so I said number 1 for him, flexibility and yoga. Number 2, I said nutrition. Number 3, I said sleep. Isn't that interesting? And we didn't even know that we were going to be on the same wavelength. So
normally are.
We try to be. That's the goal, right? Anyway, well, Marty, thanks so much. Appreciate you joining us. Thanks for teaching us.
Having me.
We might have him back, and we'll grill you some more. So thanks for your time.
Perfect.
Thanks for your time, guys. Have a great day.
Have a great day.